Today, my name is Worsham L, and I'm your host for Trauma Tip Tuesday, where we discuss concrete tips to provide trauma-informed care. So today we are discussing how do we begin engaging clients around challenges and symptoms, right? Oftentimes it can be a little uncomfortable sometimes. So I'm going to give you several different ways in which you can begin doing so. But the tip for today is to use intentional language. More specifically, make sure that the language you're using when engaging with your clients is relatable and relevant, right? Sure, there might be some jargon, some technical terms, but we want to make sure that we also have in the back of our minds how to explain these concepts in a way that is relatable to the common person, right? Because most people don't know about psychological theory, human behavior, etc. So we must be able to break down this information in a way in which any person can understand. And if you can make it happen where a child can understand, you're going to do great with making it happen for your clients. But what does this look like? How do we determine what is relatable and what is relevant for our clients, right? Number one, we want to actively listen to what our clients are telling us from the front door, why they come in to see us, to everything that they're venting about in the session, right? We want to make sure that we're being mindful of listening for the values, the intentions, the goals, and the efforts, right? Because this is going to help us to validate them, to affirm them, right? And in doing so, we're creating safety, we're building rapport. And by creating that social safety, it makes it easier to have these discussions around challenges and symptoms, right? And problem solving, especially when they feel seen, they don't feel judged, and they feel as though you are a collaborator as opposed to an assessor, okay? The second component is going to be to connect the goals and values to the discussion, right? Specifically, the goals and the values of the client should be connected to the discussion around the challenges and the symptoms, right? So for instance, if I know that a client is experiencing challenges with anger management, right, where they're feeling very easily irritable, kind of yelling at people, cussing people out, having issues with relational aspects of things at work, right? And they tell me that they really, really value work and the way in which they speak. And so I want to show them a video, right, that gives them some that tells them some information around stress responses. And I want to use that as a way to open up a dialogue about challenges. How would that look? I'm going to connect it to their goals and their values. And I might do so by asking permission, of course. Is it okay if I give some information? If they say yes at that point, or before they say yes, I might add on that I think this can be helpful in you achieving your goals of problem solving and managing those relational conflicts that are happening at work, right? So then that way, when we make sure that the client can connect concretely, right, how the information, the strategy, the skill, whatever the discussion is leading is going to help them reach their goals that they have identified, right? So we want to use the language, we want to use the information that is going to connect directly into what our client is seeking for themselves. Thirdly, make sure that you are genuine and authentic. It doesn't matter how great these tips are if we are not genuine and authentic. You are your best tool, okay? So make sure that you're genuine and authentic in the way in which you show curiosity, in the way in which you affirm and validate what it is that you're hearing, and most importantly, in the way in which you provide feedback. So I really appreciate you all for joining me here today on Trauma Tip Tuesday. Please be sure to drop in the comments any questions that you might have, or any thoughts or topics that you want covered as it relates to trauma-informed care. We are so excited for this series, and I look forward to seeing you again next week. Again, my name is Worsham L. I'm a licensed clinical social worker